Hey, Cam followers. We are doing something a little different today. We're going to the dark side and we are leaving the canine community and we're doing something really, really important. We're stepping into the world of the feline. And this is really, really important because the prevalence of osteoarthritis in cats is terrible. It is horrendous. So we're taking this opportunity to talk to our community and trying to open your eyes and your minds to what a problem we have so that you can go and start spreading this information to your friends and family and colleagues as well. Now, I've got the gorgeous Mary Ellen Goldberg back. She was here last week. She is an absolute gem. I've been chatting to her for the last half hour. She's going to be chatting all about feline osteoarthritis. But before that, I want to make a little announcement. The lovely book is available now in the shop. So this is like really dear to my heart. And this is a little character that is my dog who I sadly lost in 2018. This is Holly the Wonder Dog. It's a children's book. It's trying to help people understand the signs of pain so that we can prevent a situation where dogs are backed into a corner and the only way that they're going to be able to say, just leave me alone, please, that hurts, is biting or any of those kind of less wished for behaviors. What the book is aiming to do is be an entertaining, pleasurable read for the family. So any family that have got dogs and children, this is a real must. And then what we're hoping is that the children will go and talk to their friends. The parents are going to learn while they're reading to the kids. It's a wonderful situation. It is available now. If you go to the Cam shop today, you will get it in the post tomorrow. How exciting is this? So it's a dream come true for me. My dog is remembered forever, the amazing Holly. Anyway, let's get on today. Please, Mary, tell everybody about yourself, and then we will crack on with the cats.
I'm an old veterinary nurse. So the other thing I'm going to do is, I don't know if you can see right down there.
Oh, yeah.
This is Jimmy Cat. And Jimmy is sleeping. And he is just, so you can see, he is my only pet currently.
He rules your world as well, though, doesn't he?
Yes, he does. He does. He screams and yells at me. So I've been a veterinary nurse since 1976. And as you all probably are well aware, in the United States, it's called veterinary technician. Everywhere else in the world, it is called veterinary nurse. Why the United States is different, I don't know. And frankly, I think veterinary nurse is a much better description, but that's my personal opinion. So I've been doing this since 76. I've seen a huge, and huge is not overstating it. I've seen a huge change in viewing pain and pain management for animals. And so, I think I told Dr. Hannah last week that I have worked in colleges of veterinary medicine where dogs and horses, a lot, they did no pain management.
Yeah. Many years ago.
Because, so this was, as you said, it was the 70s, the mid 70s for me. And they did nothing.
No.
And
I think people find it hard to believe that we've actually progressed so much in the last 30 to 50 years. It's been incredible because when I qualified in 2002, there was probably only 3 non-steroidals, and now we've got a huge selection. We've got lots of adjuncts. We've got completely new approaches now. What with the piprants, the monoclonal antibodies, it is a really, really developing field. So yes, you must have seen a lot.
When I was at a veterinary practice, it was actually a mixed veterinary practice in the 80s. And I left there in 96. The only drug that was available in the 80s was butorphanol.
Oh, wow.
Injectable and tablet. That's it. Then and so when I went into lab animal medicine, there were no non-steroidals out there.
Crazy.
It was nothing. And so one of the huge things about working in research with lab animals is it is mandated by the federal government and by the USDA, United States Department of Agriculture, and by lab animal regulations that pain is handled, or is premium pain management is given to these research animals. And so in 1996, when I went to work in research, that was when I started learning, because it was a human facility, a medical research facility that had a medical school. And so I was able, every day at lunchtime, I was down reading the human journals about pain management because I was attracted to this. And so people will say, well, I can't possibly believe it has changed so much. But trust me, for someone that's almost been doing it for 50 years, it is like light years between.
I think people don't actually realize also that you're in the US. So just so anybody watching this goes, oh my God, what Cam manages to do is interview people from all around the world who give up their time. What time is it of the day at the moment over there?
It is 2:08 p.m.
Okay,
so you're in 7:08 p.m. Yes.
So I think something that's very we have in common is, now that I know what I know now, I look back on what I did know and go, oh, I could have done so much better. And we touched upon that last time with how you feel as well. So I think what we'll do is let's crack on with the cats and start giving people some huge take homes. Let's start with the prevalence, because a lot of people have been shocked by the figures about dogs. So the figures in dogs are 80% of dogs over the age of 8. The commonly mentioned one is 20% of all dogs. It might be 35%, and some people even say 60% of all dogs. So big figures. Cats, oh my God. It's
okay, so 60%, and these are figures from papers that I've got. Okay, so 60% of adult cats have osteoarthritis. 90% of cats 12 and over have radiographic changes from osteoarthritis. 25% of cats have a neuropathic component to their osteoarthritis, and changes in cats can be seen as young as 1 year of age. And
even worse, so if we were to talk about Scottish folds, which we'll talk about in a minute, that's even younger, which is horrendous.
Yes. Do you know, I honestly, so this will tell you, I don't think I've ever seen a Scottish fold.
Oh, have you not?
Now, I've seen pictures with the ears where, the ears are folded bound, but I don't think I've ever held one in my arms.
No. Well, as we're talking about Scottish folds, let's just finish the picture for people so they can go, what are they talking about? Scottish folds, to have the bent ears, which is what people are attracted to because they look pretty, they have to have a cartilage defect for that to occur. But the cartilage defect isn't just for ears, it's all cartilage. So these cats are born with degenerative joint disease. They're born with it because the cartilage isn't up to the job. So you will find that cats have already got signs of osteoarthritis from 6 months and younger. So their behavior as a young cat going, ow, that hurts, oh, that hurts, I don't want to move, I'm just going to stay really still because moving hurts me. People accept it as normal because it's a young cat. They think, well, that's just its personality. And that is horrifying, isn't it? So the International Society for Feline Medicine, ISFM, also known as Feline Advisory Bureau, they have a big thing talking about Scottish Folds, as does the Cats Protection League, trying to make people aware that that aesthetically attractive look comes with a dark, dark interior, doesn't it?
So, when you talk about nociceptors, these are like cells that recognize pain.
Mm-hmm.
And so they are highly specialized, and they are located in skin, muscle, joints, and viscera. Bone has nociceptors, but cartilage does not.
No.
So there are two definitions, because a lot of people use degenerative joint disease and osteoarthritis as the same definition. Mm-hmm. And most times for cats, it's referred to as DJD, degenerative mm-hmm. joint disease. So the definitions, to tell them apart, I thought it would be interesting for the followers. Osteoarthritis refers to primary osteoarthritis, which is, wear and tear on joints. Secondary osteoarthritis, which is changes that can be caused by malformation, trauma, a genetic condition, or some other process. Mm-hmm. But DJD, degenerative joint disease, is a progressive deterioration of one or more joints components, bone, cartilage, or ligament. And it includes any type of joint disease, which would be primary OA, infectious arthritis, and osteochondrodysplasia is what Scottish folds have. Yeah. That's the only reason I mentioned
DJD,
that.
degenerative joint disease, is like this umbrella term, and then we have these subsets underneath it, which I think is really, it's useful to know that, because terminology can get confusing. But just let's sit on the primary and secondary for a little bit, because there's a really key difference between cats and dogs. So cats are not small dogs, people. They are not small dogs. Dogs normally have osteoarthritis because of secondary joint disease, in that they've had a developmental disorder, they've had trauma, they've had sepsis. Something has preceded the joint malfunction, degeneration. Cats are primary, so they're more likely to have no underlying cause found. So I've got a tickle in my throat. I'm going to start coughing. And that's a big water. I'm just going to disappear. But that's a massive difference between dogs and cats, is that cats are often primary.
So some of the things that I've learned, and one of the people that I love talking to and has been a teacher of mine is Dr. Mark Epstein, who has several practices in North Carolina, and he lectures all over the world.
We want him on here.
And well, I can put you in touch with him too. Anyway, so one of his slides that he puts up when he's talking about pain for cats. So what would a cat look like that was having problems with osteoarthritis? Well, they don't like to be held. They don't like to be stroked. They might not raise their tail fully up in the air. They don't like to have their feet handled, and they hate nail trims. So now you could have a cat that was young, that displayed all these signs, and you might just think, well, my cat is
Just
temperamental,
difficult. Yeah.
doesn't want to be held, it's just a pill. You know,
Yeah.
maybe it's not just a pill. You know, maybe it's got something that's
Well,
causing
let's
some
spend
pain.
let's spend some more time with the identification, and I'm just going to precede this. This is so important that people realise how subtle the signs in cats are. Because for me, as a vet, say you brought your cat in for a vaccination, you said, "Oh, can you trim his nails?" And I'm saying, "These nails are very long. This cat hasn't been keeping its nails short. Little bit, clumping of fur. The cat's not looking after itself so well, but it's only 4 years old." This owner is going to get a shock when I say that this could be underlying osteoarthritis and be thinking that the vet's just trying to pull a fast one. But it really isn't like that. And it's so common. So what are the clinical signs that we would likely see? Let's add to Mark Epstein's list.
Yes. So, I specifically said, and they have, Dr. Mike Petty sent me illustrations that he had drawn for him. So decrease in grooming, that's a big one, Dr. Hannah. It really is.
Yeah.
If you have a cat, I guess a lot of people feel like as cats get very geriatric, they're not going to groom themselves as well. Well, this is true, but,
age and OA are completely interlinked.
But, if you've got a young cat that doesn't groom itself well, something's going on.
I think everybody's got to remember, cats, like they are in the cartoons, they're like, I am clean, I'm clean, I am tiger clean, clean.
Yes. It's not like the dog that likes to go out and roll in mud and play, or the puppy. Cats can't, not that they can't.
They can't stand it, can they? They're like, I must keep clean. I must be clean. So if they've got clumping of fur, dirty paws, overlong nails, start having to think why.
And reluctance to jump is massive. It's absolutely massive because, cats like to jump up on tables. They like to jump up. I know my cat, so he's 9.5. He jumps up on stuff. He likes to look out and see. And when you have your cat that doesn't like to look out anymore or just sits looking up at something, like, I wish I could get up there. One of the things you can try is putting a stepping stool there, like some kind of hassock or a chair that they can jump on that and then get on what they want to. See if they'll do it, because it might be that having that, and you can go on Amazon, you can go on anything. They sell these ramps that, whether it's a dog or a cat, they can walk up the ramp and get on something.
I'm just going to pause you. This is quite exciting. We've got people, check this out. Peru. This is a new one. Loving it. Hi, Ricardo. Nice to join. We've got somebody from Dubai. Hi. This is great. We've got Poland. Oh my God. We've got Norway. This is just getting too exciting, really. Florida. I think that's Florida, isn't it?
Yes.
Carolina. This is going international. Way happy. Good. Cool, guys. Say where you're from. Australia. Oh, Uruguay. Denmark. Israel. This is nuts. Thank you for joining us. I am very, very happy. Almost tearful. This is great. Right, back to the point. Sorry, I just had to say that. It was like, wow.
That's wonderful. So, that reluctance to jump can be a big one. Inability or reluctance to climb or descend stairs. So let me tell you something in people, okay? In people, so your knees are bad, you're older, going up steps is much easier than coming down steps. So have your people think, why? Why would it be easier to go up than to come down? Because coming down, you're putting all your weight on something, and that joint is bearing the weight, and it hurts more.
Yeah.
So
Just
go.
talking about the height, though, I just think it just dwelled a little bit there in that when we look at trying to reduce stress in cats, one of the things is providing them high up places, vantage points, to reduce their stress. So we're trying to make sure the environment is a happy environment for cats to live in. So if the cat isn't going to these high places, again, that really should spark a little thought process. And before looking for cats that can't do it, look for cats that hesitate to do it. So the resource is so important that they get up there because that's going to be where they're safe. So it's really important that they get there. They'll put themselves through a painful experience to get there, but they might hesitate, or it won't be so fluid, or they might slightly miss. And I think a lot of people wait until they stop doing it, don't they?
So fat cats, cats that are fat, they might not go up on the high places because it's hard for them. And these fat cats, they have a much larger inflammatory component going on in their body just from that fat tissue.
Yeah, I've got a figure for that. So 14% of osteoarthritis cases are also overweight. So 14%, which is still a significant figure, because obesity and overweight is something that we can manage. We can try and prevent that. But yeah, carry on about the obesity. It's not just the weight on the joints. There's the inflammatory component. Explain that to the followers.
So inflammation, they've been doing a huge amount of research on the nutritional component for inflammation and its cytokines. There are specific types of chemicals that inflammation releases into the body. And in one of my lectures about obese pets, now this is dogs and cats, it's a human slide. So it takes like a tubby, round person, but it shows all these offshoots of ways that inflammation affects different diseases, whether it's heart.
This is a cat's tail, sorry.
I love it. I love it. So whether it's heart disease or joint disease or, many, many different ways that this inflammation is bad for the body.
Yeah.
And so, I don't know how much your viewers want to go into the actual chemical structure.
I think we'll avoid that. If people want to know more about it, we'll certainly, we can do a live about that. But I think just hammering home, it's not all about the weight through the joints, because that's the logical thing. More weight you put on the joint, the more it's going to compress it, the more it's going to, irritate the joints. But there's also this inflammatory component. So when you do get the weight off these cats and dogs, you see dramatic improvements. And it is something that's financially available to everybody. One of the beautiful things about it is it is achievable by everybody, which is really important to me. I've just had Alfie do something that's just reminded me, cats that land badly. So he's a young cat, the tail just appeared here, and he's fluid. He's just fluid. And they land silently and move on. And they, when they jump, it's so smooth. And when you start hearing them land heavy or
thud.
Yeah, that's a little bit of a worry sign, isn't it?
Yes, it is. Absolutely. And I will say that probably a sign that people might even put as their number one sign would be, either they don't want to use the litter box anymore, or they miss the litter box.
Yeah.
So now one of the things, it is huge. Not being able to use the litter box or having problems with urinating and defecating. These are big reasons that people will say, I'm going to put my pet to sleep because, you know, well, am I going to let them ruin the whole house? It's big, very big. And I will tell you, I had a cat that he had bowel issues. And the reason I'm specifically saying this is because I didn't figure this out at first. So no one should sit and say, why didn't I think of that? And be willing to chastise themselves or beat themselves. Well, this cat wouldn't use the litter box all the time. And I adopted him as a senior cat, and he was he was just a mutt cat, but I think he had a lot of Maine Coon in him. Ultimately, he died from lymphoma, and he
Right.
was young. He was a little over 11,
Yeah.
which is young, But what I'm getting at is he came from this rescue group, and I thought, well, rather than use clay litter, I'm going to they make a very fine, like wood chipped litter. And he would use it, but he wouldn't use it all the time. And he would have issues where he'd go and I we had a white sofa and he pooped all over the white
Wow.
sofa. I know, I know.
Wow.
And we worked on it and scrubbed it. But I mean, it was at that point I was thinking, well, I wonder, you know, I don't know. I should know all this stuff. What can I
Oh
do?
yeah, definitely. Like
See?
seriously, if anybody wants to beat themselves up, remember this point. One of the reasons that drives me to do CAM is I didn't pick up how bad Holly was until she was progressed. I had indications that I didn't know because I, in the nicest possible way, was ignorant to it at that point.
And you can be busy.
It just wasn't in my syllabus, and it wasn't something highly talked about. The subtle behavioural changes that can indicate pain, and dogs are extremely loyal companions, and they will put themselves through so much to be with you and maintain that bond. But if you want to, that's side. If you want to learn my story, go and do CAM Advocate Level 1 because I will make you cry in Module 1 because it's a horrible story.
so
No, don't beat yourselves up, guys.
with like this wood chipped litter, and it wasn't actual like big chunks of wood chips. I'm talking very fine. But he would spend as little time in the litter box as possible. And as a last resort, I went back to clay litter that clumping clay litter that they used at the rescue group because he was found on the street.
Yeah.
And I honestly think somebody just threw him out
Yeah.
and, didn't let him back in because he was having bowel problems.
And I think you gave a key giveaway. Maine Coon are very prone to hip dysplasia. So there is a really strong link there. Hip dysplasia is a lax hip. So you've not got a nice ball and socket. You're going to have a lot of laxity. And that is therefore going to lead to osteoarthritis development. So he more than likely didn't actually like squatting.
And so, I had this litter box that it had a low area, so it was easy to get into, but it didn't register. He hated that litter that I was using. And when I went back to clay litter, all problems ended.
And do you think that was a behavioural association? Do you think he'd obviously used your litter when he was having a flare, and he might have linked that type of litter to being painful? So
Do you
therefore,
know, I honestly don't know.
Mm.
All I know is I used to be able to find, well, see, another thing, because like I said, he had lymphoma. You could find, hold on,
That's the
you,
puppy.
yes, you could,
Really? No.
you could find like frank blood in his bowel movements, and they could be very, very loose.
Yeah.
And I thought, well, maybe this is just him. It wasn't.
No.
This was the lymphoma, the
Yeah.
primary abdominal lymphoma. But going to that clay litter, all problems, litter box problems, went away. So what I'm saying to you is, you know, don't don't be ready to kill yourself if your animals
I was worried what you were going to say then.
right. Don't don't berate yourself
No.
if there are litter box problems and you can't immediately figure them out.
No.
You
And
know,
I think it's a good step back to talking about the signs. So we've got changes in temperament, we've got changes in mobility, we've got changes in ability, so their activity and ability levels, and changes in grooming and personal hygiene. They're a good 4 categories to kind of think of with cats.
and so when you're looking at behavioral changes, stick in there. They hide all the time, or they're avoiding human interaction. Your
Yeah.
cat, you watch TV, your cat used to lay there all the time. I'm not saying it has to be on top of you, because Jimmy doesn't particularly like to be squashed and held, but he lays right there
Yeah.
on it's like a table in front of a sofa.
Yeah.
And a coffee table. He lays there and stretches out whenever watching TV.
So you might see changes in the way that he lays. So I think a key take home for people is it's about change. And that change can be at a young age. So don't wait for the 12, 14, 16-year-old cat and go, oh, changed. This might even happen when they're 2, 3, 4 years old. And we have to open our minds to it. So let's move from there, talking about identifying it, into what's next, because this is where it gets really complicated for people to get their head around. Diagnosis is a nightmare.
So when you're going to go for diagnosis, there's a whole slew of things that, physical exam is where you'd start, and go into your veterinarian. And what I can say is that's one of the reasons that it's important to have a yearly physical. Even if you're not going to be getting the vaccines and all the lab work and stuff like that, it's important to have the yearly physical, because starting, like I said last week for puppies, same for kittens. Starting with kittens as a little kitten, you pick, when your veterinarian, hopefully you're not switching veterinarians every year, but when your veterinarian sees your cat, they can pick up trends. Is the cat doing something that it didn't do last year when I saw it? They can have that in their clinical notes. And so that's going to be a big impact. But
I definitely, being a first opinion vet, and I'm going to be heart on sleeve now. So say somebody came in and we've got 10 to 15-minute consults, and those subtle changes may not be something I pick up on without the help of the owner. And the ISFM, so the International Society of Feline Medicine, they have a brilliant triangle diagram where they have owner observations, physical examination, and radiography. And all 3 points can influence the diagnosis. And if we're really honest, owner observation really influences. So owners are so important, because a cat in a consult room ain't going to behave how it behaves at home. And we also know that radiography, you can have cats with quite severe osteoarthritis and no changes on x-ray. So the key player is actually the owner, isn't it?
Absolutely. And there is, I'll be talking about this a little later, but there has been a questionnaire developed for owners, and it's called the Feline Musculoskeletal Pain Index. And there are several that it's classified as a clinical metrology instrument. So these are things that are given to owners, and there are several different kinds, but there's a specific paper that it's Duncan LaSalle is on that paper, and it was in Veterinary Record in 2019. This particular paper evaluated 4 different clinical metrology instruments for cats.
Yeah.
And it came up with the fact that the FMPI is the one most tested and most recommended.
What we can do is put a link to it, can't we?
Yes, you can. And you can give it to owners. I mean, so this would be something that if the owner came in, the secretary could have these, a stack of them, and they could say, or possibly before they go in, could you fill this out and bring it with you? Could you fill it out before you see the doctor? The doctor can look at it and see this is the owner's opinion. It's not the veterinarian's opinion. It's the owner's opinion.
Yeah.
What are you seeing at home? What could possibly be different?
Yeah.
And these are extremely helpful. Very helpful.
The puppy is chewing a chair up. Just 2 seconds.
Oh, yes.
Yeah, so the only problem with using these clinical metrology instruments is only problems. People don't know about them, so this is why we're talking about them. People don't know where to get hold of them, so we're going to put the links below. People don't see value in doing them prior to the consult, and vets and the practices are often too busy to remember to use them. So owners, please take the incentive. We'll put the links, share it with people, because they can be so helpful, because you're going to get better value for money in that consult. You might be going in for a vaccine, you might be going in for something else, but you're going to get more out of that consult.
Well,
using them.
And people
Ruby. Do you want to meet Ruby? Hey, Ruby.
Oh, yes, everybody will love this.
This is Ruby. Ruby is in my care at the moment. Ruby's trying to destroy this Facebook Live. There you go. Right.
Ruby's bored. That's what.
Ruby's really bored. Really bored. Yeah, so we've got the instruments, and
and the point of, most of these websites where they can be found, you can enter as an owner, you can enter as veterinary staff, so that it's not only veterinarians that have access to
absolutely.
this stuff.
What we'll do is we'll put the links there. Yeah.
It's owners as well. And as you say, it makes the owner part. That's what's so important in chronic pain, is that the owner is vital to figuring out where the pain is coming from. So it's not just blood work and radiographs and test after test after test, things can get narrowed down quite readily
Yeah,
when
100.
the owner is involved. And I can't stress that enough.
And I think
For
it's quite
people.
commonplace, if we're really, really honest, it's commonplace for cats not to have radiography. I think if we really looked at the figures of what percentage of dogs with suspect OA go all the way through to diagnostic imaging, the figure is going to be a lot higher than in cats. Now, it doesn't mean that we shouldn't do diagnostic imaging. It's just the way it is. Whether people
Yes.
don't want to invest the money, whether people want to just try a conservative approach first, whatever the reason. But let's just talk about diagnostic imaging a little bit, because I think people find this quite hard to understand. Surely if there's something wrong, you should see it. And that diagnostic imaging should be the pinnacle and it will give you all the answers. Not so, because some of them can have pretty significant arthritic changes and you see nothing on the x-ray. And others can have quite significant changes and not show any signs of discomfort. So it can be quite hard work. So that's why the owner observation of behavior change, capability change, etc. at home is so, so important. Can we, just because I'm looking at the time, because it's already 40 minutes, can we step into now what are we going to do about it? Because already the lovely Ricardo, who is over from Peru, which is great, he's already jumping straight in there like swimwear. So what do we do?
What do you do? Okay, so some of the things that you can do, like I said, these instruments, these CMIs that are for osteoarthritis or for evaluation for the animal, they add so much. However, and quality of life instruments, that the cheat sheet that I gave you, I've got all these links on it.
Yes, we're going to share them.
If the people can have those, they can go and find all this information themselves,
Yes.
whether it's an owner or a veterinarian. But so, let's say that an owner comes in, they've got their cat, the cat is displaying behaviors that could possibly be osteoarthritis. What would probably be the first thing that the veterinarian would do? Well, if the cat's overweight, they're going to suggest weight loss.
Yeah.
If the cat, I have listed on this sheet various drugs and dosages. So different drugs that can be utilized would be, as if that was Ricardo where he said NSAIDs. So the NSAIDs that are most prevalent for cats are meloxicam or robenacoxib. Carprofen can be given to cats and has been out there longer than any other NSAID for dogs or cats. But these drugs can be utilized. The things that people worry about for cats. So the first thing would be, put the cat on an NSAID and see if there's an improvement.
Yeah, that's what I was hoping you're going to talk about. I think it wasn't that we got pulled up on this before, but we've got on the website a empowerment pyramid for owners to use, and things that can be done is to help an arthritic dog. And at the bottom, it's identifying chronic pain, blah, 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 blah. And the RSPCA, the lovely people, are like, this almost looks like a flow diagram. Surely pain management always comes first. I was like, no, it's a volume of influence pyramid. It's not a flow diagram. So let's just make that clear, because you said the vet will say weight management first. No, probably at the same time as saying, if you're seeing indications of pain, the most important thing we do is get on top of that pain, as you said. And what would they do? The non-steroidals for a course, isn't it?
And the thing that they have to worry about for cats is it is important to do the blood work because cats can go into chronic renal failure. And
Yes.
and now, one of the things years ago, if the animal has renal failure or chronic renal failure, you take them off all NSAIDs. That is not the case any longer.
Yes.
Any longer, what you're looking at is the drugs meloxicam and robenacoxib are metabolized in different ways than other NSAIDs.
Mm.
They are not metabolized through the kidneys.
Mm.
And so, with meloxicam and robenacoxib, the main thing, yes, the cat can be in renal failure. If you check their parameters, their blood chemistries, as long as the lowest possible dose for that NSAID is utilized. So the recommended dosage for meloxicam, the loading dose, is 0.1 mg per kg orally, followed by 0.05 mg per kg orally every 24 hours. What if you can get it down to 0.025
Mm.
mg per kg? If the lowest possible dosage for this NSAID is going to have a much less impact on the
Well, let's tell them about the
kidneys.
study where this all came out. So, first of all, I just want to say, I think blood work, doing it so you know where you stand with your cat or your dog before introducing medication is kind to you, kind to the cat, dog, and kind to the medication, because I see it all the time where people go, this drug caused kidney disease. And you're like, well, you didn't do blood work before you started the drug. So there's a strong possibility your animal had kidney disease or liver disease. And now that you've done blood work, having been on the medication, you assume it's the medication. So blood work prior is safe for everybody, including the drug, because the drug gets bad press, which it doesn't need to get. But the reason you're talking about this was there was a profound study that showed that cats in up to stage 2 kidney disease, so iris staging stage 2, actually lived longer when they were on a non-steroidal.
Yes.
And the reason being, cats were there. The suspicion is that they were more comfortable, so they were more mobile, so they were able to eat, drink, and toilet to maintain normal bodily functions. Their stress levels, we would assume, were likely lower because they weren't in pain. And we know what stress can do. So that is a big study that made people go, oh my.
And I think that was an ISFM study as well. It was the International Society for Feline Medicine. So it was in the Journal for Feline Medicine and Surgery. And it was a huge study. What it showed.
Yeah, because if you work just on the theoretical, what the pharmacokinetics of these drugs can do, you would be like, oh, it would never work, never work. And that's why clinical trials are really important, because on paper and reality can be very, very different, can't they? But in that study, we went from being really limited what we could do for any cat in chronic renal insufficiency. And we were in a welfare pit. We were in a black hole of, they've got chronic kidney disease, they've got OA, and we're stuffed. What do we do? What a jump with welfare. Being able to say, we know non-steroidals have a massive impact on pain, and we can use it up until this point. Not now, really. So, I know, it's hilarious, isn't it? This is probably the worst, worst interruption.
It's funny. I think it's funny. So, and for along with other medications that can be put in there would be things like gabapentin, and I've got this on the sheet, and amantadine, and amitriptyline, which is a antidepressant.
Yeah.
Amitriptyline is a drug similar to ketamine.
Yeah.
It is Holly, help me because my mind has gone blank.
So yes, amitriptyline is like a tricyclic antidepressant, and it has
not that the amantadine
amantadine,
is an
NMDA receptor inhibitor.
Yes.
The same family as 1 minute. No. Here we go.
And gabapentin, the doses that are on the sheet are 5 to 10 mg per kg for gabapentin every 8 to 12 hours. Well, one of the people that I know, her name is Dr. Robin Downing, and she has a pain practice in Colorado, and she has cats and dogs that are on large doses of gabapentin. And she said that when a dog or a cat gets put on this gabapentin, what you need to be looking at is you increase the dosage slowly until you have no signs of pain any longer. And that's if you have some type of nerve pain, neuropathic pain.
Yeah.
Because she said, she has dogs and cats on massive doses. And her factor was, at what point was the dog or the cat sleeping too much?
Yeah.
And when they were sleeping too much, she would back down the dosage. And she said she's had cats that, it would be dosages that we would all say, well, did you kill the animal? But it wasn't. The neuropathic pain for that particular animal was such that the high dosage got rid of pain, the animal functioned normally, and they were not sleepy. They were not always drowsy.
And that's a really good point to mention, because something that comes up on Holly's Army, which is our Facebook community group, is a real fear of drugs like gabapentin, because there's the association of what impact it can have on humans. And so there are people out there that do really well on it, and there are people out there that don't do well on it. And there's a tendency to extrapolate from your own personal experiences, which you can't actually do to a different species. Another thing to just mention about gabapentin, which leads us into a topic that we must cover, is stress. And gabapentin is now being used a lot for taking cats to the vets, because it reduces the anxiety levels. So popping a gabapentin in prior to the journey can have a profound effect on the animal in the consult room. So whether it has an effect on neuropathic pain and stress is another thing to consider. So don't be scared of these suggestions that your vet mentions. Embrace them.
Dr. Sheila Robertson, who is from Scotland and lectures in the UK all the time. She lives in Florida and has been, she's an anesthesiologist. She's, in her lectures, she talks about gabapentin and trazodone. And she says with gabapentin, if you give 100 milligram capsule of gabapentin prior to the visit to coming to the vet, so, an hour before you're going to go to the vet, you give your cat something to eat. You can put the capsule in it, or you can dump the granules from the capsule in some food, have the cat. It's not so vile like
tramadol.
Oh, I know.
It's not great, I won't lie. My cat Derek, so I've got Derek, who is now nearly 20, and he's on meloxicam, he's on amantadine, he was on gabapentin, and he gets acupuncture and massage and thermotherapy, and he's got lifestyle modifications. He's got lower litter tray, he's got a warm bed, he's got all of these. He has PMF as well. So he's got loads, he's got his myriad of interventions. Tableting him is still not pleasant. And I think that's one of the really difficult things with managing cats, is medicating.
Well, it absolutely is. You can look at video of cats that have received tramadol orally.
Yes.
And it's all this slobber coming down their cheeks and drooling. And it's not that they're sick from the tablet, it's just that the tramadol is so vile tasting.
Seriously, Ruby, stop it. I'm so sorry. I'm going to blame my friend Rupert.
Don't worry about that in the slightest. But I have, I have down. So things for your 20-year-old cat, things that absolutely should be thought of. And it's not only let's give them a pill, because that's not the only things. Acupuncture, as you say, massage, and massage can be taught to the owners so that they can do it every day. If their cat will lay there for them, they can do it every day for their cat. So there's also transcutaneous electrical nerve stimulation, and that's something probably that a rehab facility or physiotherapist would utilize. There's laser therapy, and there's, as you say, the targeted pulsed electromagnetic field therapy. So do they have it for sale in the UK?
Yeah, no, it's for sale.
As the Assisi Loop?
So there's the Assisi Loop over here, and then there's Westville PMF, and there is Respond Systems, I think.
Yes, Respond makes an entire bed. It's like and dogs or cats can utilize it, and it's the electromagnetic therapy that the animal lays on the bed and can be helpful. And then there's different physical rehab exercises.
There's lots of that, and there's lots of lifestyle changes as well. In that, I think the CAM multimodal diagram, which I'm sure Barbara, who's doing an amazing job, thank you, Barbara, would put up for us, is very applicable to cats, looking at lifestyle adaptation, complementary therapies, bringing in maybe a supplement from the side, your non-steroidal foundational. But what this lovely Vicky is just asking about, can I introduce natural pain relief medication, acupuncture? What about this injection? The real truth is, Vicky, is there is no cookbook approach. There is no, David Dyker says, cookie cutter approach, because you have to be willing to say, I'm going to try this pathway first, and I'm going to see what the response is. So learning how your cat shows you discomfort is the most important thing, foundational, because you can then see whether what you're doing is working. And things like acupuncture, they suggest once to twice a week for 3 to 4 weeks before saying that hasn't worked. For non-steroidals, 28 days minimum before saying, I'm not sure it's working. All of these interventions, it's not going to be a quick fix. And you've just got to kind of have a crib sheet in your head and go, I'm going to try this one first. What's the response? I'm going to try this. What's the response? But
so just like with dogs, something that owners can try, natural medicine, would be, there are specific foods that I know Hills makes, JD, which is a joint diet, and then Royal Canin makes a mobility diet. So, these things have omega-3 fatty acids in them, different things that people might take as supplements for their joints. Look, for myself, I take turmeric and fish oil. I take an omega-3. So what I'm getting at is, yes, you can try any of those, and you don't have to have a prescription for those. And you may see an improvement in some of those.
But it's going to take months.
Things.
I think people, again, I hear this all the time where people say, I've put them on a glucosamine supplement and in 2 weeks I've seen a difference. Well, that's actually not possible. That just is not possible. And the same with the omega-3s. When you look at how they are incorporated into the cellular membrane, that's not going to happen overnight. So when you go down the supplement route, a bit the same as everything else. You've got to be willing to give, 2-3 months before you make.
And Dr. Mark Epstein has something, when he lectures, he talks about the placebo effect for the owner and for the veterinarian is huge, like 75%.
Yeah.
So you put an animal on a supplement, okay? And a week later, you're saying, my dog or my cat is a puppy or a kitten again.
Yeah.
Well, it may be, maybe it is, but there's also a much larger percentage that this is the placebo effect on the owner and on the veterinarian. So the owner should take heart that it's not just, that this affects the veterinarian also. It's not just, the owner.
No, and I think I've always really struggled with how to advise people when changes are going to be subtle and they're going to be over a long time, and the disease naturally does this anyway, So how can I help people make the right decisions? And I think it's try and use something like a clinical metrology instrument, get a baseline where you're at, introduce something and give it time. Then look at doing a clinical metrology instrument, this questionnaire again, and look at consistency. So if say your cat has been on a supplement, say an omega-3 supplemented food for 3 months, and you repeatedly do the questionnaire at that point, and it's always better, that's really good. That's good. But you've just got to have a methodical approach. Otherwise, we can really slip into believing things work rather than checking that they're working.
And I will say that when you start adding things that are medications, you might see an improvement faster. But this is a medication. Something that is a natural supplement will take longer.
Yeah.
The other thing that I think is very true that you have stated, you said your 20-year-old cat gets acupuncture. How often?
Every time I can get near him, because he's still a little bit of a bastard.
Oh, okay. All right. So, this is very true with cats.
Well, actually, can I be really rude and butt in? I'm just going to give you another real life story to make people feel better. So Derek the cat came to me from the Cats Protection League at a year old. And at that point, he'd been rehomed because he was horrible. And he came to the practice and he was smoochy. But he would turn and he would be nasty. And a couple of years later, we were like, wait a minute, there's a bit of a limp there. And we x-rayed him. He had such bad hip dysplasia, horrendous, that he had one of his hip joints removed. So he had a femoral head ostectomy. That just shows you, I'm a veterinary professional, and we assumed that 1-2-year-old cat was just a bit of a handful. He was in pain, and throughout his life, he has been terrible to handle. He's got banished from 3 vets. He was told never to come back. So we all miss things, and we're all learning. So that's a big take home, guys. Hands up. God, this dog. If I put her outside, she'll just bark. So anyway, let's finish chatting about other things that we can do, especially focusing on like lifestyle. Because again, like with weight loss, identifying and monitoring as much as weight control, lifestyle are free interventions, aren't they?
Yes, absolutely. And, you can do things to, for instance, I'll tell you, my cat that had lymphoma, that when he died from being, from an anesthetic procedure that we just couldn't bring him back from. Right. And it was from the lymphoma. However, that morning, he jumped up on a table.
Right.
And so what I'm saying is you can have a pet that is going to be the exact opposite of some of the things that I tell you are signs.
Yeah.
So he jumped up on the table and looked around my screened porch and was interested in stuff. And that was before I had to take him in to be looked at.
Yeah.
And then, he got anesthetized and radiographed, and he had massive lymphoma that had invaded his whole body.
Yeah.
Anyway, my point is the fact that he was a very sick cat,
And he was still
but
very
he
able.
was but he was able to jump up on stuff. And
No,
so
and somebody once said to me, the worst thing is they always have a last good day. And it was the same with Holly. And if you were so inclined, you could go and look back through Facebook. When we started Cam, I used my journey to really help other people. It's probably driving me mad. And you will witness her last good day, because we had a following of 1,500, 2,000 people who were cheering me on, my journey with my dog. And we all watched her have a last good day. And then 2 days later, it was time. So yes, you're 100% right. And I think it's just really hard for people. But just to play with the lifestyle changes a little bit more, what kind of things would you implement in a house to try and make a cat's life easier?
an orthopedic bed, a soft bed, it can be heated, because you can get heated beds that makes the joints feel better, or just an orthopedic kind of bed. But the cushioning that goes with that is, a lot of cats like, you'd be amazed at how an animal that's just laying on the floor and gets up and lays down and gets up and lays down, if they have a comfortable bed, it's like the Princess and the Pea, the story. They will lay down and sleep. So environmental enrichment, a litter box that has very low sides.
Yeah.
And I don't know about the UK. Amazon, the website Amazon in the United States, you can find litter
Anything.
boxes that have these really low sides so the cat can just step into it, and step.
You can just use a tea tray as well, guys. I think
Yes.
sometimes you have to accept there's going to be a little bit of sprinkling around the tray. But again, anti-slip so that they can step in and out easily. That's really important.
Food bowls raised, and they make them for cats so that it's up off the floor. The cat doesn't have to bend down as far. And why is that important? If they have osteoarthritis in their spine, neck, thoracic, back, lumbar and sacral, they might not want to be hunched over and bent, eating and drinking.
Yeah.
And so having a raised food bowl can be a big thing
Yeah.
for this arthritic
Cat
animal.
flaps, that's another big one. So many people use cat flaps, and they're actually a feat of physical capability to get through. So looking at whether it's hard to get in and out, that's a good question. What height for the food bowls? There is no cookie cutter approach. It's more a little bit logical. So I say put a magazine, put the bowl on, and then 2 magazines, then 3 magazines, and see what your cat seems most comfortable with.
And, I would say, so I don't know, 3 inches off the floor. When you go on a website like Amazon, they're going to have specific heights that you can buy. But your suggestion about the magazine or a book is actually much better, because then they can determine what's the height, and then they can get whatever they want.
Yeah,
and
exactly.
So, yes.
Don't spend money like Billio, guys. I am the queen of low cost. But other things, like my friend, in her older cat, she'd noticed it stopped using the scratching post. So she then took the vertical scratching post and made it a horizontal one. and that made the cat a lot happier. Having lots of raised surfaces. Let me get this dog out. You go out, go out, go out. Hi. Okay. So moving things so that they can jump onto a surface to get to access points. As I say, definitely steps. Well done, Barbara, 100%.
A lot of people buy, and they can actually make it. When I say a ramp, there are a lot of people that for their older dog or cat, they have a ramp so they can get up on the bed. The ramp can be also a scratching post because it's very gradual, but the cat can walk up and get on the bed, and then it doesn't have to jump up and down.
Yeah, and also think about in the garden. If you have quite an enclosed garden, and you know your cat always climbs that fence to get over that wall to get to that little alleyway where it always goes to the poo or it marks its territory. Think about things that you can do in and around. Like, imagine following your cat around and just going, right, oh, hesitancy, you had a bit of difficult, what can I do there? Oh, yeah, you've stopped doing that. What can I change there? It's actually quite logical. And I think I want people to feel empowered that they can do this. It's you don't need to spend loads of money, guys. Somebody's just asked about supplements. Sadly, CAM doesn't advise specific supplements because we try and stay independent and we don't endorse products because none of them have a strong evidence base that goes, yes, that's the one. But in my situation, if I was doing it from my opinion, understanding how difficult it is to medicate cats in any shape or form, I would always go and use a diet. So I would hop onto one of the diets and I would take that stress away from me. Trying to work with Derek at the moment, trying to get 3 or 4 different pills in him, no way.
I agree with you 100% because these diets have been researched. They've been formulated. Do you have Purina diets in the UK?
We've got Purina, yeah.
Okay, so Purina makes a supplement diet. Royal Canin makes a supplement diet, and Hills makes a supplement diet. Those are 3 that I know of that, a huge amount of nutritional research has gone into them and studies. So, it's now cats are difficult to switch. You may not have a cat that will eat anything. Maybe yours is, they call them finicky for a reason.
Yeah.
But what people, I used to have owners come in and say to me, my cat hasn't eaten and it's going to die. And I would say something like, how long has it been since your cat ate? Well, I put down and specifically for like a reducing diet. Well, it's been 3 days. And I would say, well, your 3 days is not going to kill your animal. It's drinking water, right?
Yeah.
And I go, yes.
As long as they're not obese, because fatty liver is something that we have to be aware of. Yeah. So I think you're right. I think cats
yes. I understand what you're talking about.
Yeah.
Yes. Hepatic,
lipidosis.
Lipidosis. You do have to worry about that for cats. Absolutely. But, if it's your average fat cat that needs to lose some weight, I used to just be amazed at the fact that they'll eat. I mean,
I think as you say, we've got extremes and we've got owners that if they haven't eaten in the last 4 hours are panicking because that's how they measure whether their cat's happy. And then you don't want to go all to the other end of the spectrum and be like, well, I'm going to sit this one out. It's 7 days now. There's that kind of logical balance and transferring across in a very slow, methodical way.
I'll tell you about my cat, Jimmy. So Jimmy, I have an IAMS cat food, a senior food for Jimmy. He's 9.5. Okay. So Jimmy eats it and he likes it very much. However, Jimmy would much rather have treats. And he will sit and scream at me, meow, meow. And I just ignore. Now, Now, see, I realize people might not be as hard-hearted as I am, but I just ignore him, and I go, oh, well. And I say, you've got food, you can eat,
Yeah.
just I'm not paying any attention to you. And then see, as he's gone and laid down, he realizes, well, Mama isn't gonna look at me right now. She's busy doing something.
Yes, that's what I'm given is there. No, I think that's really good point. So let's kind of like work around intervention. So if we know that a cat is in pain, so we've seen behavioral changes, physical changes, activity changes, grooming changes, I think it's fair to say that that cat could be in a significant amount of pain. So our biggest priority at that point is to get some form of pain relief in that's going to work quickly. We don't want to leave that animal in pain because we know that it will magnify and we'll end up with a more complex pain situation to manage. And so far at this point, our anti-inflammatories, the non-steroidals, are the key players. And we have got something coming in the background. We've got the monoclonal antibody from Zoetis called Silencia. That's exciting, but it's very new. And then alongside that, we're going to be doing our weight management. We're going to be looking at our lifestyle changes. We'll think about adding a supplement in whichever way. We're thinking about physical therapies and complementary therapies. And we might find that we need to add adjunct medication, such as the gabapentins, amantadines, amitriptylines. Some vets over here are doing injectable ketamine under the skin that lasts about 3 to 5 days and having really good results with that. We've then got our other things, which are not so used in cats, but the intra-articulars. So we still got the PRPs, the stem cells, the hyaluronic acids, the aquamids. So we got that area. We got surgery. So like with my cat, the joint was non-salvageable. So we were like, right, get a shot of it. And he was a lot happier after it. Do not think that you've only got non-steroidal. There is many things that you can do. The key thing and the reason we did today is we need to be aware about it and we need to be able to identify it, because then we've got a lot of options to us. Fair to say?
And absolutely. And as you have done with your cat, before you give up on the cat, think about acupuncture, because I have seen animals, and it's not often that this happens, but I have seen animals, cats, that have gone in, that have been completely paralyzed in the back end. They've gone in for one session of acupuncture and they get up and can walk. Now, it's not going to last. They need to go back for more acupuncture, but acupuncture it's amazing. It
But I think that applies to everything.
is.
We were talking just before we went live. We were talking about those profound cases where you're like, did I just witness that? And you were talking about your friend who used a certain medication and just was like, oh my God, that dog has just changed 180 degrees. And I've had the same with a dog where massage, unbelievable improvement. And I think what people should go away from this is feeling empowered to try things, realists, being able to observe, because your recipe might be very different to everybody else's, but
Yes.
it works for you. And if you follow the crib sheet of anti-inflammatory, adjunct, weight control, complementary therapy, physical therapies, lifestyle change, if you look at that and go, what's available to me? What can I afford? What can I access? Try this, and then see what unfolds. But I think all of us have seen mind-blowing changes for different interventions, haven't we?
Oh,
Be it
absolutely.
laser, shockwave, non-steroidals, surgery, intra-articular. Wows. Yeah.
So, and I've seen in physiotherapy or rehab, an animal comes in, I don't want any medications. I'm worried about its kidneys. It's old. I just don't want it. Laser therapy, photobiomodulation, and acupuncture, and just basic like passive range of motion for the joints can be a huge improvement. Now, it's also individual, just like you said, but you can have certain individuals that they don't have to have a drug. They can have other quote unquote complementary therapy and have big improvements.
They can do. I had to, just out of interest, and this is just from my experiences, I had to do a lecture recently about, the things that we incorporate, our interventions. And one thing that does always fascinate me is that owners, if you ask them what they would like to do, they want something that's easy. They want something that is low maintenance. They want something that's going to work quickly. They want something that's affordable. They don't want to have to transport their cat, all these things. And when you add it all up, that does equal an anti-inflammatory at the end of the day. And sometimes I feel that people are so concerned about what they read online, they forget the benefits that come with it. And we are managing cats who are quite hard to handle, and being able to pop a liquid in or pop a pill into the food could, for that cat, be the best thing ever. You don't have to handle it much. It doesn't have to go to the vet on a regular basis or the complementary therapist. Minimal handling, yay. So I just keep your minds open, guys. Look at what is on your smorgasbord of interventions and find what suits you. Try not to narrow mind. Try and be broad, but also make sure that they're working. I think that's a key point, is that nothing comes with a promise. Nothing. And
Absolutely.
Even if you've got an osteoarthritic cat and you put it on a non-steroidal, you've got to check it's working, because that might not be enough, or you might have got the wrong diagnosis. We've been chatting for an hour and 20, Mary.
All right, we gotta go.
We gotta go. Before we go, I'm just going to let people know about our sponsor. Okay, so we've got quite an abnormal sponsor, but something that makes me very, very happy, because when I started this in 2015, I wanted people to think about lifestyle change because it's available to everybody. It's generally very affordable. It has profound impact. And I wanted to find a flooring. And up until that point, I could not find anything bar rugs, carpets, etc., that really seemed to work. Now, this company, Floors for Paws, they have a product range, and we tried it out, and I wasn't convinced. So they're laminated. I just didn't feel it was as good as it could be. Well, they came back 4 years later. 4 years, hats off to them. And they've got a new product out called Paw Safe. I swear to God, it's amazing. I've been doing yoga in socks on it to see if I slip. No. And it's affordable. It's a very attractive lino. There you go, guys. What's really great about this is we have a very mutually beneficial relationship. I tell the world about it, and we get 10% of profit of all sales. So if they sell over to America, Peru, Finland, wherever you are, Cam will get a benefit, which is huge because we are self-funded. We're a vet-led, self-funded organisation. So there you go. Mary, thank you for joining us again. You're lovely.
You're welcome. Thank you all, and thank you viewers.
Thank you, viewers,
for putting up with me.
Not at all. If you've got questions, do put them down. We will endeavour to get all of those links on here so you can go and do some hunting. If you have found this useful, we will do more about cats. And I would feel very comfortable doing more about cats because they don't get the attention they deserve. So just let us know. But until that point, thank you so much, Mary. Thank you for watching from all over the world. Wow. And we will see you on, I believe it's Thursday. We have an amazing guy who is a vet, and he's a dog trainer, and he's coming to join us. I think it's Mr. Mitchell. It's going to be with Amy. So till then, see you later, guys.